Women, has your period gone MIA for months again but pregnancy is not the cause? The long pause in menstruation is called amenorrhea. This week's video will be focusing on amenorrhea, its definition, causes, types, and natural remedies. Amenorrhea is defined as the absence of menstrual periods, for consecutive cycles, for women of reproductive age. It's a condition associated with hormone imbalance. In a regular menstrual cycle, there is roughly 1 week of bleeding followed by 21 days without, until the next cycle begins. Women who experience amenorrhea may have a shorter menstrual time but then not begin the next cycle for months at a time. There are many causes to this condition, including improper diet, lifestyle factors, stress, and hormonal problems. More serious causes may include medical conditions and disorders such as polycystic ovarian syndrome. Having disorders that cause amenorrhea often contributes to infertility due to hormonal imbalances. There are two kinds of amenorrhea, primary and secondary. Let's go over them each. Primary amenorrhea is when menstruation is delayed but other sexuality characteristics develop normally during puberty. This can be caused by problems with glands producing less gonadotropin, a hormone that controls menstruation. Secondary amenorrhea is when a woman who has had normal menstrual cycles but suddenly stops for more than 90 days in a row. The cause of this is usually pregnancy, breastfeeding, or impending menopause. Hypothalamic amenorrhea is a secondary type and occurs when the hypothalamus doesn't release certain hormones needed for ovulation and menstruation. Some serious cases indicate medical conditions or disorders like PCOS or thyroid disorders. While the exact cause for it cannot be determined without more information, it's important to know the possible symptoms which could help in making a diagnosis. Medical history also helps since underlying health issues may shed light on the cause. Blood or saliva tests may be done to check hormone levels and thyroid function and to rule out pregnancy. Since amenorrhea is a result of hormonal issues, the symptoms can come on like a domino effect. Girls who have amenorrhea can experience infertility, pelvic pain, headaches, mood swings, and low libido. Some symptoms are tied to underlying health conditions like extreme fatigue or weakness of the body. Polycystic ovarian syndrome, or PCOS, is the most common health condition causing amenorrhea. PCOS brings with it other symptoms as well, including increased androgens and polycystic ovaries often seen in ultrasounds. If you have amenorrhea and are looking for a solution, there are some herbs that may relieve symptoms. Herbs such as dong quai, chasteberry, red raspberry leaf, black cohosh, and maca have been used for centuries. In addition to herbal remedies, dietary and lifestyle changes can help balance your hormones and decrease the symptoms associated with amenorrhea. Other natural supplements and natural hormone creams can help in balancing hormones. Fertile Balance Progesterone Cream and Cycle Balance Natural Progesterone Oil help with low progesterone levels. Progesterone is a key hormone for menstruation. Having the right amount also aids in maintaining pregnancy and preventing miscarriage. DIM is a compound that balances estrogen and androgen hormones. This reduces symptoms like facial hair in PCOS and mood swings for menopausal women. Having these hormones in check can help with amenorrhea and increase chances of fertility. So ladies, if your period is still taking too long, it may be time to run some tests, starting with a saliva hormone test to determine if your hormone levels are a factor. Check out our blogs and sites for more information about the products and information mentioned here and natural health in general. And watch our previous videos about women's fertility and health.